Hi, welcome to Victory Stories. I'm Mindy.TV, certified transformational nutrition coach and yoga teacher, and I am here with Dr. Sophia Gim. She is a chiropractor and yoga teacher as well. So we're here at BeAti Acupuncture and Chiropractic here in New York City. So give me an idea of who are the people that you help here in your practice.
Okay, so here, mainly the patients that come in have pain, have chronic pain.
Would you explain to someone who's never seen a chiropractor before, how would you explain the treatment?
Okay, so chiropractors, we do, the main thing we do is something called adjustments. So when we look at a vertebrae, there's 31 bones lined up, right? And then we use our hands to feel the spine to check to see if there's any misalignment. So it should be like a straight line. And then when we detect a misalignment, we would go there and then we would do a quick but low amplitude adjustment to correct the spine. Yeah.
That's amazing.
And that is important because inside the vertebrae we have the nerves. We have the spinal cord and then all the spinal nerves coming out to the sides. And if one bone is misaligned, even one or more bones are misaligned, that could impinge on the nerves that comes out from the sides of the vertebrae. So we try to get that to release.
That makes so much sense. And like you said, with all of the nerves and people having pain, so if a couple vertebrae are out, you might not feel it in your neck, but you might feel it somewhere else in your body.
Yeah, that could happen.
Right?
And it's not only the neck or the back that a nerve could get impinged. It could actually get impinged in your limbs. There are areas where it could be due to muscles, it could be due to joints that could impinge on the nerve. So yeah, those treatments we do also.
Tell me a little bit about you. What is your story?
So, in my childhood, I was always very, very obese. I wasn't aware that I was obese at the time, but as I reached my teenage years, I started becoming self-conscious about my body. So that's when my parents bought me a treadmill. I started running on the treadmill every day for over a year, and I lost many pounds. Yeah, and then I started becoming to like exercise and movement.
Yeah, so you got the treadmill, you lost all that weight, and you just started feeling better and better. And then tell me a little bit more about how you got into this field, or what happened after.
So and then I really got into the nutrition aspects of health. And then I decided to become a nutrition, which I majored in nutrition in college. And it was really fun, but I wanted to pursue something more. So I decided to go to graduate school for chiropractic to see patients in pain. So yeah.
Okay, very nice.
In my mid-20s, I just decided that I needed to do something more than treadmill. And then I came across hot yoga and how it really helps with the weight loss. So my goal was to just lose more weight. And then I chose hot yoga, and I lost a lot of weight that time. And then it also curbed my cravings. So yeah.
That's amazing.
Yeah.
So total weight loss from childhood to your 20s when you were doing the treadmill and yoga. Do you know what that total was?
I would say 80 to 100. Yeah.
Wow. So yeah, you worked really hard.
Yes, I did.
You lost all of that. That's amazing.
And while doing yoga, I realized the other benefits of yoga that had on me. It really helped with anxiety, stress, tension, just with the overall emotional and spiritual aspects. It just really got me to a more positive person. I just become a more positive person doing yoga. So that's a change that I saw aside from the weight loss.
That's really great. So you almost felt like you finally had like all the pieces together with the food and the exercise, and then like your mind and body just came together when you found yoga.
Yes, and I continue to do it today.
You lost all that weight, and then you just kept moving forward with all of that transformation and that energy and that positivity. So you went from studying nutrition to now studying chiropractic. And so now you're here in New York City. You have this practice at BeAti Acupuncture. And so with all of the patients that you've seen now and all of the successes, out of all of those, what is the one patient that has had just the most miraculous transformation?
Yeah, so there was a lady, and she came to me with knee pain. She was a little bit overweight herself, and then she's been having the knee pain for years. And she would take a lot of painkillers for that because she couldn't sleep. So I treated her using something called Graston Technique for her knee, for the muscles around her knee. I did some joint manipulation on the knee, and I stretched her muscles surrounding the knee. I saw her 2 to 3 times a week, and then by like the 3rd or 4th visit, she started feeling relief.
That's really fast.
And then she was taking less medications for pain, so that was very it was big.
Yeah. That is big, because I mean, so many people I've heard of have, like, if they have knee pain, they just go have surgery. And so
she didn't want that. She didn't want to go that route. So she wanted to see like some natural therapies that were out there. So she was a really successful case.
That is miraculous. Thank you so much for sharing. To share with someone who's been thinking about coming to see a chiropractor for pain, but they haven't because they're scared and they've never seen a chiropractor before.
I'll totally understand patients who've never tried chiropractic, and adjustment may sound scary because sometimes it does make an audible noise, and sometimes patients think that's like bone cracking. But actually the sound that you hear during an adjustment is just like little gases coming out of the joints. So it's not really like a bone grinding on bone. So yeah, I think people with pain should definitely give it a try. There is no side effect, almost no side effects. So yeah, it's pretty gentle actually. I mean, did you feel that it's gentle?
Oh, totally. Yeah, it's totally gentle. But yeah, I know what you mean, like with the sound sometimes, especially in my neck.
Yeah.
Like I always hear that pop, and sometimes it sounds, a little crazy. But I didn't know that about the gases coming out.
Yeah, it's just like the gas coming out of the joint. So there is in between the spinal bones we have a disc, and there's a lot of fluid in there. And then there's inside fluid, there's gases that it's just there. And then when I adjust a joint, suddenly the gas just releases and just creates that audible noise. So that's the noise. Yeah.
That's really interesting. So we have gases inside of the discs, inside our vertebrae. So I want to see what your opinion is. But when people like crack their knuckles constantly, do you think that's a good thing or a bad thing, and why?
I think that is a bad thing.
Bad thing.
And I know it's a bad thing because when people habitually crack their knuckles or their neck, they're actually overstretching the joints. We have something called a joint capsule in every joint. And then that capsule, we need to be very stable in every joint. We need mobility and flexibility, but at the same time we need stability. So those joint capsule help with the stability. And if you can like habitually start cracking one specific joint, that will be stretched or kind of unstable. So I wouldn't advise that. And I wouldn't advise that.
So don't do that. Don't crack your knuckles.
Yeah, you don't want to damage the joints.
Your neck.
No.
I'm guilty of that one. Where even if you feel like it needs popped, still don't do it. Just come see you instead.
Still don't do it because usually when one feels that it needs to be popped and then they kind of pop their neck, the joint that is getting self-adjusted is usually the joint that's hypermobile.
Oh.
But then what chiropractors find are joints that are hypomobile, that are not easily moving. So definitely I think you should advise not to pop.
Okay.
I'll pop your neck
Okay.
where it goes, yeah.
All right, thank you. Okay, Dr. Gim is going to do a little treatment on me so you can see how this works. And you're doing the...
Today we'll be demonstrating the Graston Technique specifically for tennis elbow.
Okay. Sounds good.
So I'm going to use a little emollient to apply to the extensor group of the forearm. This is just to reduce the friction and get the instrument to glide easier. Oh, should I raise this a little?
Sure, that's fine. So that little tool is the Graston tool?
This is a metal tool. I'm going to use this first. I'm going to start scanning to see if there's any adhesions or grittiness. Some areas you'll feel like smooth, and then some areas you feel gritty.
So you just feel that and like the vibration of like sliding it across my muscles. And so the adhesions are like traumas to the muscle, or what does that mean?
Adhesions are little scar tissues that form after trauma, after surgery, just after repetitive use. And right away you see this reddening occurring here where the grittiness are.
I have some grittiness.
Yeah, so that means that's just increasing the blood flow to the area.
Okay.
Which is all normal. We want the blood to increase to stimulate the healing process.
Right.
And sometimes you might see some little red spots that are called petechiae. They're just blood vessels that break off. And that's all normal too.
Okay. So yeah, you're bringing blood to the surface. So the blood is bringing nutrients to that
blood to heal
area,
to stimulate healing.
Awesome.
So how do you feel?
Good. It's just like a deep tissue massage.
No pain?
No. And even though the tool looks kind of scary, it doesn't hurt. There are definitely some areas that are like a little tender, but obviously that means there's like something there to like release.
Yeah, some restrictions. So we're gonna work all the way up to this area here, the lateral epicondyle, which the extensor muscles it inserts to here. We try to get that to release.
I don't even use my left hand that often. I'm not even sure how all that happened.
So this technique is done for no more than 10 minutes. I would say at least 2 times a week. For at least 10 to 12 sessions, it will be effective in terms of pain. You see the little petechiae forming here?
Yeah.
Just means that there were some adhesions in that area. A little more for me. You okay?
Yeah. Yeah, that area is just heating up a little bit. So it's just really interesting to see the changes in the skin, and you just can feel obviously the changes in what's happening.
Okay.
All better. So Dr. Gim did the Graston Technique on my arm to help with like tennis elbow or any tightness or pain that you would have in the forearm. And now she's going to show some taping.
So this is gonna help. This is gonna microscopically lift the skin up, and then it's gonna increase all the blood to the area, so you get continual healing as you leave the office.
Cool.
So this could be stayed on for up to 3 days.
So it's almost like a facelift for my arm, and it looks cool too. That's awesome. I love that you chose that color. Good to go. Yeah.
Welcome.
Yeah. So then also, so I'm all about victory, and it's about, like, even if you were a victim, about not staying a victim and just making the choice to live the victory life. So with that said, you know, you've made all these changes and you're a victory. So what are your top 3 tips that you would like to share?
Okay, the first one is when I cook, I always use coconut oil. I think that's one of the best things you could do when cooking. The second would be having a positive mindset. So I say positive affirmations constantly throughout the days. Yeah, and then the third one would be yoga. Just regular yoga practice just really keeps me balanced.
That's amazing. So the coconut oil, I love that. I use that for like everything too. Would you say that cooking with it is better because of like reducing oxidation, or use it for flavor?
Reducing oxidation, yeah. The flavor is definitely good too. And also it's anti-inflammatory. Yeah, just overall, it's a better choice when compared to other oils.
And then back to your positive affirmations that you say throughout the day. Would you share one with us?
Yeah, so whenever there's situations that are not too positive, I would always go back to my gratitude affirmation. So I would always start with, so I am grateful for, I am grateful because, and whatever that situation is. So I always try to really quickly turn things around so that I don't get pulled into the negativity. So yeah, that really helps me to stay more balanced. Yeah.
That's great. I love the gratitude practice. I try to do that myself. And like you said, sometimes it's hard to like get out of the negativity, but I just love that because you start thinking about what you're grateful for. You can always think of something, and then that transforms that thought.
And then just if it's really hard to get out of a negative thought, it's just really a good tool to just repeat it. And then along the way you will find yourself, shift. So and also I keep a gratitude journal.
Nice.
At least once a week I try to write things that I am grateful for, so I don't forget, because there's so many things we should be grateful for in a day that we just kind of go by and not remember. But keeping that really helps me to keep my mind on the positive side. So yeah,
that's great. I love it. And then the last one of yoga. Is there a certain type of yoga that you love to do more than others?
Oh, my favorite is vinyasa yoga, but particularly hot vinyasa.
Okay, you still love the hot. Yeah.
That's just my personal preference, because I really like to sweat things out like a lot in one class. So and also I like to stay in those pigeon poses. I'm sure you know that releases a lot of emotions or any negative thoughts that are kept in the hips. So I like to stay in those poses for a long time, even before I sleep. So I do a lot of pigeon poses at home.
I love it. Thank you so much for sharing. And I really enjoyed talking with you about all of these things, and I'm sure you all have a lot of things that you can take away from this. And if you are having pain and you're searching for answers, try chiropractic. And if you're in New York City, obviously come see Dr. Gim at BeAti Acupuncture and Chiropractic. I will have the link in the show notes so you can find her. And thank you so much.
Thank you.
All right, see you soon. Thanks. Bye.